Why are vets greedy? Ooh, bold question, but I'm going to answer it because it's a sentiment that I hear a lot from pet owners, and I think it deserves to be discussed. I'm going to start out by saying that most vets are not greedy. Remember, you're talking about people who, from a very early age, have dedicated their lives to pursuing a career path that allows them to help animals because they are sensitive, they care, they want to do good in the world. On the other hand, there are some vets that are greedy. I've seen some really bad things from behind the scenes, and I've heard some horror stories. There are two sides to this coin. The first thing is most pet owners have absolutely no understanding of the financial reality of medical care. No matter where you live, if your pet experiences a major catastrophic medical, that is going to cost thousands and thousands of dollars. I've seen dogs get hit by cars going 80 kilometers an hour and get the treatment that they needed and survive and recover and go on to live an incredible life. But those owners probably shelled out tens of thousands of dollars. Something as simple as a broken leg, most of the time those require surgery, and that's going to be $4,000 or $5,000, sometimes more, depending on the type of injury and where you live. It all boils down to math. Medical overhead to have the staff, medical equipment, the facilities to be able to provide good quality care is incredibly expensive. Every single item has a high dollar price. X-ray machines, ultrasound machines, $50,000 to $100,000. There's a 5-year amortization on medical equipment, meaning after 5 years, its value is zero. Pet owners have no concept of the amount of personal and financial sacrifice that goes into becoming a veterinarian. It is a life of service, hard work. It's 4 years of university, 4 years of vet school. Specialists will do 5-6 additional years of advanced training. My student loans are still in the hundreds of thousands, and just the interest that accrues is nearly $1,000 a month. I was really surprised. The entire day of our first day of vet school was dedicated to the financial burden, like, hey, this is your last chance to back out. Graph after graph. This is the average student loan debt. This is the average salary. Be aware, every vet I know has been burdened by their student loans. Here's the thing. In our vet school class, there were about 130 people. I can say, over 4 years, you get to know everybody pretty well. Almost everybody has a good heart, and they're there for the right reasons. They're working their butts off. They're living in poverty because the little boy or girl inside them wants to be a veterinarian. There was at least one person, maybe two, that you kind of knew from day one. They're gonna go in and they're just going to take advantage of everybody. And these are the kind of people that don't have a personal ethic. Cheating on tests, they're cheating on their girlfriends, they're lying, they're stealing. Just like in a group of 150 people in any profession, you're going to have one or two of those types. I've seen greed in the veterinary profession, and I've asked myself this question before: why do vets become greedy? There's a really good TED Talk called The Psychology of Evil, where it kind of talks about what makes normal people go wrong. They use some extreme examples, prison guard situations and torture in the military. But at the end of the day, it's the same question. Why would good people allow their personal ethic to become eroded? And at the end, they conclude that it is the system that's guilty. There are a lot of different factors that go into play. Certain pressures, authority without oversight, conforming. So you kind of start out with a situation where you have really good people. They are under incredible financial pressure because their overhead costs are high, their own student loan debt is high. They've worked so hard and they want to have basic necessities to provide for their family. I'll just be honest and tell you, as part of our curriculum, there was a veterinary practice management course. The business consultants want veterinarians to run a profitable business so that they can pay their bills and live comfortably. There are many value-driven clinics, but there are also profit-driven business models as well, where sales are incentivized. Every person from the veterinarian to the receptionist, it's like working on commission. Production-based salaries are designed to reward the people that are working the hardest, that are seeing the most cases. But it also can create a temptation to sell services and products that aren't really necessary. My little brother called me the other day. He took his healthy young dog to the vet. He just said that he had the distinct feeling that they were just trying to sell him stuff and take advantage of him. Veterinarians coming into a hospital where there's a highly profit-driven culture can easily fall into this trap. And I know that when I was a lot younger, I felt myself fall into that trap a little bit as well. Feeling like I was getting rewarded for selling products and services. Ultimately, I found that I got myself in over my head sometimes doing elective procedures that, maybe weren't in the patient's best interest. A lot of older patients aren't good anesthetic candidates, and even though they might need an elective procedure like a lump removal or a dental, they're not healthy enough to do it, and then you end up with a bad outcome. For a short time, I worked in a hospital where there truly was a profit-driven culture, and I just had a bad feeling about it even from the first time I walked in there. That feeling just got stronger and stronger. There were rules about running diagnostic tests for every patient that walks in the door based on their age. There were also rules about not referring patients to specialists because that was felt to take business away from the hospital. And so I think as a pet owner, you also need to be aware of this so that you can protect yourself and be your own best advocate. As I've matured, I always ask myself, what is the standpoint of the patient's best medical interest? This was somebody's child. What would be the appropriate course of action? That's not appropriate for all pet owners, but a lot of pet owners these days think of their little dog or cat as a member of the family or almost as a child, and they do want to do what's best for that pet. At the end of the day, running diagnostic tests to try to figure out what a problem is and you're not getting any answers, you really do have to keep looking. And the more tests you run, there will be escalating costs associated with that. Because I see a lot of serious things on emergency, I send a lot of referrals to specialists. I know that there's somebody with more expertise and training that can do a better job of getting that pet the care that it needs. Really good, high quality medical care, especially for catastrophic medical. It's not cheap, it's expensive. It's really incredible the level of medical care that can be offered to pets who either have good medical insurance or whose owners can afford it. And for everybody else, they don't have that privilege. It's the same story on repeat. Something major happens, the dog needs a lot of medical care. And owners, they're completely shocked, can't provide it. So the veterinarians are put in a situation where we have to choose between either euthanizing the pet or having it surrendered to somebody else that possibly can care for it. And I can tell you, this is not what animal shelters are for. It's like you're backed into a corner. So just to summarize, why are vets greedy? First of all, most vets aren't greedy. And please stop calling them that, because veterinarians have one of the highest burnout rates of any profession. It's a profession in crisis. Our job is hard enough as it is. It's very stressful, very demanding. We deal with highly emotional and highly opinionated clients all day. And then to be called things like greedy, knowing everything that you have put into becoming a veterinarian, just makes you really not want to do it anymore. And there are times, especially after dealing with difficult clients, that I just want to quit. So get informed about the financial reality of medical care and protect yourself by getting good medical insurance so that if something out of the blue serious happens, or later as your pet ages and develops geriatric problems, pets can get kidney failure, diabetes, cancer. All of those conditions can be treated. There are veterinary cancer specialists, there are cardiology specialists, there's neurosurgeons. But when you're dealing with something serious like that, the owners will be facing very large medical bills. So get informed about the financial reality of medical care and protect yourself so that if something happens down the road, you don't have to make decisions. Sometimes these decisions are choosing between life and death. Before you get a pet, make sure that you're really ready. This is like having a toddler for the next 15 to 20 years. Are you prepared for that daily commitment? It's a lot. Get informed and make sure that you're prepared for the financial obligation of pet ownership. And 3, be aware that there is greed out there. There are bad ethics. Just like in every industry, you will find people who are going to take advantage of their clients for personal or financial gain. Follow your gut instinct and make sure that your vet is someone that you're comfortable with and that you trust them. And if not, ask other pet owners, ask for a second opinion. That's never wrong. Trust your instincts, be your own advocate, be your pet's advocate. So thanks for your question. I'm glad you said it because a lot of other people do too. And I hope that this discussion was helpful. I realize this is probably going to elicit a lot of really negative emotions from both sides. But if you have any comments or there's something that you want to say, try to be civil. We'd love to hear what you have to say. I hope that helps answer your question, and all the best.